President, I rise on behalf of the residents of the South East who have had their access to health services slashed by the Malinowska State Government. The latest victims of Labor's savage cuts to regional health services are the residents of Lucindale, of Coonalpyn and of Tintinara. The Minister for Health and Wellbeing, in response to a question on this very topic 2 weeks ago in the other place, said that he would be happy to listen to the community's concerns about these changes. Well, Mr Acting President, the Minister has already had ample opportunity to listen when the whole Cabinet visited the Limestone Coast less than 5 months ago. What was the point of their fly-in, fly-out trip to the South East if it wasn't to listen and act on the concerns of the community? We know for a fact that regional health was a major topic of concern held by those who attended their town hall meeting, thanks to reporting by the local media. And when local resident and owner of the local post office, Jeff Robinson, expressed his strong concerns about the cancellation of drop-in nursing services at the Lucindale Medical Centre, Minister Picton's answer was that this was done to spread appointments across the week when there was demand. As the Naracoorte Herald reported, the Health Minister responded to Mr Robinson saying, and I quote, "Obviously, it is important that we maintain those local nursing services for the people in Lucindale and to do it in a way which is going to get the most effective outcome," end quote. If ripping nurses out of small regional towns is the most effective outcome, I hold grave concerns for what it means for the rest of our country communities. Road-based GP David Senior, who visits Lucindale once a week, believes the decision shows a lack of understanding of the work the Lucindale-based nurses do. Further highlighting the tin ear of this government, after listening to Dr Robinson's concerns, Minister Picton responded by saying, and I quote, "Obviously, that's not meeting the expectations of Jeff representing the community," end quote. Here we have an acknowledgement that the Minister has known for at least 5 months about the changes to the nursing services in Lucindale, yet has only recently committed to again listen to the community. Well, Mrs Acting President, the community has spoken, and they've done so loudly. The Health Minister can listen all he wants, but his lack of action so far shows that he is unwilling to intervene and act upon the concerns held by our regional communities. And in just the case of the Health Minister is of the mistaken belief that this is just a beat-up by the Liberal Party, opposing government decisions for the sake of opposition, I can let you know that I was proactively reached out to by Lucindale disability advocate Ashley Reynolds. Ashley does not only support the other side of politics than me, he was in fact a Labor Party member and former unionist. Ashley was horrified to learn of the effective closure of the Lucindale nursing service, a closure which came with no consultation whatsoever with the local community. It started with the removal of telephone nursing service, meaning calls for help and assistance went completely unanswered. He has personally had to ring the Naracoorte service multiple times for an appointment with a nurse in Lucindale, but invariably none are available. Ashley has been a disability advocate for over 30 years and is very critical of this government's attempts to centralise health services in Naracoorte. But arguably, he is most critical about the misappropriation of the well-founded law that is being used as an excuse to cut these services, which is Gale's Law, which requires a second responder to attend to a nurse out of hours or unscheduled call-outs in remote areas of South Australia. So this is unfortunately being misappropriated as a justification for nursing services cuts in small towns. Sadly, it's not only Lucindale that is reeling from these cuts in nursing services. The Tintinara Community Health Centre was closed without notice last year after being staffed by local nurses and open 4 hours every weekday. It has also now become an appointment-only service, with nurses travelling from Murray Bridge if Tintinara residents can't travel 80 kilometres to Menengi or 115 kilometres to Murray Bridge. Local residents in Coonalpyn are disgusted with the cuts to their nurses, with the local health network claim is being done to provide services in line with need. Thankfully, the Coorong District Council are taking up the fight to return nurses 3 days a week in their clinic. Mrs Acting President, this government's attempts to centralise services in small towns like Lucindale, like Coonalpyn and Tintinara simply doesn't make sense due to their geographical spread. Make no mistake, I am seriously concerned that this is transforming health 2.0. Country Health Connect couldn't be more disconnected to the local people they are there to help, thanks to this Malinowska's Labor government.